Welcome to our educational video series, the 3 Minutes Anesthesia and Critical Care Medicine. Today we're going to talk about a very interesting topic about bicarbonate and what is used for in the clinical practice. So we use bicarbonate every day, but the question is here, which of the following is considered class 1 recommendation for the bicarbonate use? Hyperkalemia, tricyclic antidepressant overdose, the metabolic acidosis secondary to severe diarrhea, or acidosis secondary to hypoxia or lactic acidosis. Before we give you the answer for this question, we should go over what's meant by the classifications of recommendation. So, when a treatment or procedure considered class 1, this means that this procedure or this treatment, it has a very well-known and established role, and the benefits are well-known, and the treatment is indicated, recommended, and most of the time it is helpful. Okay? When you go for class 2, here's a division. There is 2A and 2B. 2A is, again, it has benefits which are exceeding the risks, but we need some more support from the evidence. The treatment here considered reasonable and it can be useful. After 2A, here, before you give any medication or any procedure, you should think, because in 2B, you will see that the treatment can be considered, but you are unsure about the effectiveness or the usefulness of this procedure or the treatment. And when you go for 3, here you will see that the treatment has risks more than benefits. And the treatment usually is not indicated and associated with harm. So it's very important to know these definitions before we go over the answer of this question. So which of the following is the class 1 recommendation? The established role and the benefits of bicarbonate, it's a class 1, is only in hyperkalemia. Okay, so what about the other clinical scenarios that we use it on everyday basis? What about the use of bicarbonate in the cases of the non-anion gap acidosis, like acidosis secondary to bicarb loss, as in case of diarrhea? In these cases, bicarb use is 2A. It's reasonable, and as we agreed before, it's helpful. What about the use of sodium bicarbonate in lactic acidosis secondary to hypoxia? Actually, it is a very common practice that we give sodium bicarbonate for a patient with acidosis secondary to hyperperfusion or lactic acidosis. And indeed, this practice is considered as 3, and it has to do with more harm than benefits. It includes the myocardial depression, hypocalcemia, the left shift of the oxygen saturation curve, and many other side effects. So before we finish this topic, we're going to talk about 2 more things about bicarbonate. One of them is that sodium carbonate, if you are using it to treat hyperkalemia, you should give it first before calcium, because if you give it after calcium, they will combine together, and then the effectiveness of sodium bicarbonate will be much less. And if you are running levofed, you shouldn't mix it with bicarbonate, because levofed, it needs an acidic solution to work. And if it runs with sodium bicarbonate, it will not work well. So these are the references that we used for this video. And thank you so much for following us. And please don't forget to subscribe. Thank you so much.